Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then clinical features of focal nodular hyperplasia. So if you see the clinical features of focal nodular hyperplasia, the patient with focal nodular hyperplasia will present with incidental, this is mainly seen as incidental finding in a majority of patients at the laparoscopy or in imaging, in majority or in most of the patients. Then so it is asymptomatic in most of the patients. In symptomatic patients, vague abdominal pain is seen. If you see the alpha fetoprotein levels, the alpha fetoprotein levels will be found to be normal in these patients. Then, diagnosis of focal nodular hyperplasia. In the diagnosis of focal nodular hyperplasia, it is diagnosed by a contrast enhanced CT scan or MRI. Here you will see presence of a homogeneous mass is seen with central scarring. You will see that there is a homogeneous mass will be present. There is a homogeneous mass will be present along with the central scarring. There is a central scar is present with radiating like this, okay, then with radiating septa, and this will rapidly, this homogeneous mass with central scarring will rapidly enhance during the arterial phase of the contrast administration. During the arterial phase of contrast administration, they will rapidly, okay, they will rapidly enhance on arterial phase of contrast administration. Histological resection and diagnosis, histological confirmation and diagnosis is important for definitive diagnosis. Then treatment of focal nodular hyperplasia. In the treatment, no treatment is required in asymptomatic patients. In asymptomatic patients with radiological features also, no treatment is required. But resection is done only in case of diagnostic uncertainty, and for histological confirmation we can do resection, but normally we can leave the tumor as it is.
thank you and thank you for watching.